Hello. Hey, LinkedIn friends. Hey, YouTube friends. It's another Wednesday. So, we're here to talk all things health content writing. And today is going to be more of a personal, it's going to start out with a more personal story about how I made the transition from more traditional formal medical writing to freelance health content writing, because I think understanding some of that background will be helpful to any of you who may be healthcare professionals who are already in the medical writing space, but who have not had experience with health content writing specifically and might not know as much about that particular type of medical and health writing. So, this is going to be a fun episode. For those who I haven't had the pleasure of meeting before, please feel free to introduce yourselves in the comments. Let me know your name, what you do, what you're interested in, what you're looking forward to learning during this conversation. I am Megan. I'm a public health pharmacist by training. Hey, Sylvia, girl, what's up? I am a public health pharmacist by training, but I work as a health content strategist through my company, Stock Rose Creative. And also, I run the Health Professionals to Health Writers program, of which Sylvia has referenced when she said, "Hi, coach," because she's been through that program. It's an accelerator that teaches pharmacists and other healthcare providers how to replace a portion of their income through freelance health content writing, which makes this conversation in particular really appropriate and relevant. So again, introduce yourself in the comments if we haven't met before, and let me know what you're looking forward to hearing or learning from the conversation, whether you're catching live on the replay, because I can always respond to those comments after the fact. So I'm first going to share a little bit about all of the medical writing roles that I've had, because there have been a lot. So I'm going to give a little snapshot of what all of those have been. I'm going to talk about why, spoiler alert, I prefer health content writing specifically. And then I'm going to talk a little bit about that transition and how I made it, because that will be helpful for you as you are thinking about possibly making that transition as well. So, starting with the different types of medical writing roles I've been in medical writing for 10 plus years at this point, more than a decade. The very first experience I had with medical writing, I don't think I even was really cognizant of the fact that what I was doing was considered medical writing. It was a work study experience that I had during my undergraduate years, and I was editing drug content on this cancer education website, and I was also helping develop that content from scratch. But for me, it was just, I don't know, I didn't put that together with medical writing or even health content in my mind. It just seemed like something interesting. And it's actually, I would say, like a 30% of what inspired me to go to pharmacy school in the first place. But that was early on, before I knew what I was doing and what it was called. Other roles that I've had where I was more cognizant of what I was doing, during pharmacy school, the summer after my P2 year, I did a fellowship at the CDC. It was the Ferguson Fellowship. And my particular project and preceptor was heavily focused on the development of a manuscript that we were going to be ultimately submitting for publication. And so I was on the med safety team, and essentially doing like this months long literature review about infectious outbreaks that were linked to compounding pharmacies, which was eventually, more than a year later, published in the Journal of Patient Safety. But that was a very writing intensive experience that was more so on the scientific publication side of things, because it was us preparing and writing and editing a manuscript. Later on, I did a postgraduate fellowship. So it was called formerly the Regulatory Pharmaceutical Fellowship in Drug Information, a long name, but there were two parts of that experience where I did medical writing. So one component of that was a drug information rotation in a hospital system. It was within Indiana University's hospital system. And so it was kind of a hospital-based drug information rotation where either providers or patients would call in and ask whatever their drug information questions were, and we would create memos in response to the questions that they were asking. So that was one component of the fellowship. And then in the second rotation of the fellowship, I was working in medical information at Janssen Scientific Affairs, which is the pharmaceutical arm of Johnson and Johnson. And I was working on Invocana at the time, basically preparing memos to be sent out in response to drug information questions, but then also as we would get questions that we did not have set materials for, kind of creating those on the spot. So that was an interesting experience because I think it was the first time where all of the writing I was doing was about one specific medication. So it was an experience where I was able to dive really, really deep into one particular area and write about it all the time. Um, other two other medical writing experiences I've had. One was in regulatory writing, and oddly enough, it was at the CDC, not for a pharmaceutical company or biotech company, which is probably where your mind would initially go when you're thinking about regulatory writing. But this particular role was supporting um, rare diseases, drugs and vaccines that are in the strategic national stockpile, and making sure that the documentation, the regulatory documentation that is necessary in order for people to access those medications, vaccines, et cetera, was in place. So it was a lot of writing and editing of EUAs, which we're all really familiar with hearing that acronym now, emergency use instructions or EUIs, in some cases INDs, that type of thing. So it was different than any other type of medical writing I had done before. And then lastly, this is the medical writing like role that I had that is probably most similar to what I actually do as a health content strategist, which was working again at the CDC as a health communications fellow on a team that was specifically working on antibiotic safety and antibiotic stewardship. So this was the role that I had that I think opened my eyes to what some of the less formal medical writing opportunities looked like, and showed me what it could mean to create materials that were geared towards more of a patient audience or a lay audience, people who did not have a healthcare background. So as opposed to writing like memos or regulatory documents, I was writing fact sheets and brochures and blog posts and editorials and things that are more digestible for the general public. And I consider that a really pivotal moment in my career because, again, it opened my eyes to more of the possibilities that lie within the medical and health writing world that I wasn't necessarily aware of. And if I was aware at the time, it just wasn't something that I ever thought about. So all of that led to me eventually landing in health content writing, which again, at the end, I'll talk about more about how that transition happened. But one of the reasons I prefer health content writing, specifically on a freelance basis, in comparison to all of those other types of roles that I talked about, well, there are a few reasons why. Okay, so the first reason is that I feel like I'm able to have a more broad influence on public health as a freelance health content writer, purely because of the ways that people come across health content in their daily lives. So when people are hopping in Google and asking a health question, which like I think over 7 billion searches every year are health related. When people go to Google and ask those really important health questions, the articles that come up, those are examples oftentimes of health content. And I know personally how much I use Google for that type of thing. And so I know that the ability to reach people when they're looking for concrete answers and you know that they are going to act on those answers is really, really important. And it makes me feel like I'm having a broad and deep impact when I'm contributing to the content that I know people are going to see when they go to Google and ask a question. So I feel like health content writing helps you impact public health on a broader scale. I think that it also contributes to fighting a lot of the misinformation that is out there online. Hey, Manali, it's nice to meet you. Thanks for joining in. It helps contribute. It helps it helps to flood out a lot of the bad information that is out there, because as we know, as healthcare providers, there are a lot of people who either intentionally or unintentionally share and spread information, health information that is inaccurate, that is potentially harmful, that is potentially dangerous. And one of the things that I identified about my professional desires as I was kind of thinking back on the trajectory of my career is that I really want the communications and the writing work that I do to help combat that misinformation. And I think that health content writing is an excellent way to do that, because if we are creating good content, accurate content, engaging content, then that is going to be more useful for people. And the algorithms, especially if we're thinking about Google and how SEO or search engine optimization works, the algorithms have a way of prioritizing that content that is accurate, that is legitimate, that is engaging, that is useful for people. And so health content writing gives you the opportunity to take advantage of that. I think there's more room for creativity in health content writing, which is one of the key reasons why I kind of settled in that space as my lane. Um, I realized throughout my writing career that, I mean, I love to write, like, period. I just enjoy writing. But I was missing in that opportunity to apply more creativity to the writing that I was doing. And I felt like, we're healthcare professionals, right? We're kind of nerds, it's okay, it's fine. I've accepted that. It's cool. But not everybody gets excited about, reading the latest CDC morbidity and mortality weekly report, right? Or the latest article that was published in the Lancet. Like, that is not just something that the general public is doing for fun. We might consider that interesting. Even if we don't consider it interesting, we know that it's necessary for our work as healthcare professionals. But what I love about health content writing is the challenge that exists when you're trying to figure out, how do I take this information that might be highly technical, highly scientific, and therefore very much boring, and make it interesting and relevant and applicable for the people who actually need that information. That is exciting for me. It helps me. It helps me use a different part of my brain that you aren't necessarily using when you're so deep in that, like, direct patient care or healthcare setting, that very clinical audience. And so I find that really exciting. And I know a lot of the students that I've worked with in health professionals, health writers, have found that really exciting as well. Challenging at first, because you have to get used to it, because we're not used to using that part of our brains in the context of what we do. But once you start to do it, it becomes very interesting and makes the work that you do more fulfilling. Two more things, two more reasons why I prefer health content writing over some of these other writing roles that I've had before. You get to work with really dope health organizations and brands and companies um, who might be your traditional healthcare institutions, right? They might be hospitals, they might be clinics, they might be pharmacies. But a lot of times there are also more innovative health companies. So there might be health companies that are less traditional, that are trying to improve healthcare in a variety of ways. And when you work with those types of companies, and even with the more traditional companies, you're constantly learning about what's going on in the healthcare industry, what patients are responding to, in different ways that you can plug in as a writer to help people get the most out of the products or the services that they're interested in, and using those as opportunities to educate. And then the last thing, and one of the main reasons that I prefer health content writing over other types, is that health content writing is very freelance friendly. Freelance friendly. Say that again. Let's try it again. Health content writing is very freelance friendly. And what I mean by that is, it's something that you are able to do even if you still have, like, a primary job, a primary source of income, right? When I first started freelance writing, I had a full-time job, and I kind of stumbled into freelance writing accidentally, which I'll tell you more about in a second, but it was something that I was able to do alongside that job for I would say a year, maybe a year, until I went full time in my business. And so it's great because even if you like all not all healthcare providers want to just throw away their direct patient care careers and start doing something else. Like that's not necessarily a desire for everyone. That's not necessarily a reality for everyone. So I love health content writing because unlike drug information or publications or regulatory writing, some of these other types of writing, health content writing is um, the culture of it is heavily steeped in freelancing and freelancers. And the benefit of freelancing is that if you have that primary source of income that you want to keep, you're totally able to do that. But you also have the ability to take on clients outside of that, bring in some additional income, and also add a layer to your professional repertoire that might feel more fulfilling for you, might feel more interesting for you. And it's also really a professional development opportunity. I know that a lot of pharmacists specifically and also other healthcare providers have really been thinking about how do I branch out? How do I learn something new? What do I learn new? And then how do I do that when I have like a job and I need that job because I have bills and I have loans and we still got loans. August 24th, if you're a healthcare provider, you probably still have loans. So thinking about ways thinking about opportunities that allow you to grow professionally, that allow you to dabble in things that you might find interesting and creative and fulfilling, but that still allow you to like execute your primary job. I think is really important for a lot of people. And so health content writing is one of those specific types of medical and health writing that allows for that flexibility. And, as different things come up in life, you have the ability to take on more clients, take on less clients. There have been times where I just coasted along with like one client, like I'm good, I can't handle anything else right now. And there have been times, especially kind of in the thick of when I was working in my business full time, where I might have had 6 to 7 clients at one time. So it's very flexible and very freelance friendly, which I think is another huge benefit of health content writing. So, going into the section about how I made this transition, which I think will be helpful for you if you are a healthcare professional who's also a more traditional medical writer and are interested in possibly making this transition later down the line. So, again, as I kind of spoiled earlier, my transition was accidental. During the time when I was working in that regulatory writing role that I told y'all about, that was my first experience in regulatory writing, and it felt a little dry for me, right? It felt a little dry because it's regulatory, right? I spent a lot of time reading through literal regulations, creating materials that the direct audience was the FDA. So it was very different than some of the work that I had done in the past. And much like I was saying to you all earlier about how like freelancing on the side can allow you to get that dose of creativity you need, even if you're like in a very cut and dry button up role. This was that, right? I was in this cut and dry button up regulatory writing role, but I wanted that boost of creativity. So I started a blog, like just for my family and friends. And it was a public health, pharmacy related blog, and a company came across that blog some kind of way, reached out to me, said, "Hey, would you like to write for us?" That was the moment when I realized that like health content writing was a thing. It was something that companies found valuable. My first thought was, well, if they find this useful and they're willing to pay for it, other companies must find this useful as well, must be willing to pay for it. And so I my challenge then was figuring out, okay, how do I intentionally do this, right? How do I intentionally get another company who wants me to write for them? And so there were two large buckets that I had to figure out how to fill. in this transition. The first bucket was I had to learn how to write. And that may sound odd because I just spent the past however many minutes, 20 minutes, talking about all the writing that I had already done. The thing about health content writing is that the style of writing you are doing when you are writing to a patient or lay audience is very different from any type of medical writing that you are doing for a clinician or a scientific audience. It's just not the same. Um, Also, the format of what you are writing is probably very different. As a traditional medical writer, you might be writing manuscripts for publication. You might be writing CE materials. Those could be written, those could be presentations. You might be, like I was, you might be writing EUAs and EUIs and INDs. None of those things translate to a patient audience. And in the case of health content writing, what I was doing primarily was writing blogs. Even when you're writing a blog for a clinical audience, that's not the same as writing a blog for a patient audience, right? So the reason I say the one of the huge buckets was learning how to write was because I had to learn how to write in a different way for a different audience in a different format, and that takes a lot of work. So it takes a lot of work. It's not impossible. So I want to give that caveat as well. It's not impossible. I learned how to do it. I've had students who come through health professionals, health writers, who have a background in medical writing, but who came through the program because they knew that they wanted to transition to health content writing and did not have that background. So those students have also learned how to take their existing writing skills and to translate that into something that is more suitable and appropriate for freelance health content writing. So just an element of reassurance there that this is possible. It's just something that takes work. So that was the first huge bucket, which was learning how to write blogs. The other huge bucket that I needed to fill when I was transitioning from medical writing, formal traditional medical writing, to freelance health content writing was the actual freelance part, right? The business of being a freelancer. Because one of the things I think people forget is that freelancing is a business. It is a way of generating income for yourself or on behalf of your company. And that requires some business know-how and some business savvy. And I did not have that at all. Writing is only half of that equation. The business part is the other half of that equation. And so when I decided that I wanted to make this transition from formal traditional medical writing to freelance health content writing, those are two of the huge buckets that I had to fill. And if you are a healthcare provider who is also a medical writer, who is also thinking about making that transition from some of the more formal medical writing you might be doing to some freelance health content writing, those are the two things that I think you need to keep in mind. How do you learn how to write in a different style for a different audience in a different format? Also, how do you learn the business side of freelancing, of getting contracts, of getting clients, of having conversations with people who you might be interested in working with, of invoicing, of all the things that you might not even think about initially? How do you learn all of those things? And so when I was right in that transitional period, which would have been 2018, these are all things that I had to learn on my own. And it's one of the reasons why I created the Health Professionals to Health Writers program, was because I knew that there was nothing out there that existed that actually taught healthcare professionals how to make that transition. And I thought it was really important to create something like that because more of us need to be in a position where we are creating the health content that people are seeing when they're going to Google and asking health questions. Throughout the past 2 years, 2 years and some change, we've seen the literal repercussions of the spread of misinformation when it comes to health, public health, healthcare. And so I think it's really important for more of us to be in a position where we're able to fight that, combat that misinformation, and positively influence public health in this way through health content, through communicating engaging and accurate health information. So if you're interested in making this transition down the line, I would highly encourage you to sign up for the waitlist for the Health Professionals to Health Writers program. You can always just drop waitlist in the comments or reach out to me via messages if that's something that you would be interested in signing up for. And as always, if you have any questions or comments or feedback, please feel free to leave those in the comments. You can always share what your main takeaway was from this conversation. And I look forward to continuing this conversation soon. So y'all have a good night.